beginning of electricity was in the 1790s with Benjamin Franklin's famous kite experiment. Because of his studies, electricity was taken from a mystical form. Indeed, in Ben's day, if your house was struck by lightning, you were considered someone that deserved punishment by God. Franklin was considered the top scientist in the world at the time, giving him great influence in Europe through the scientific community on his experience with electricity. I have been fascinated with our founding fathers, especially Benjamin Franklin. While speaking in Philadelphia for the American Podiatric Medical Society, I visited the Pennsylvania Hospital, and in this hospital is the nation's first operating room. The picture at the very bottom right is seen by every physician while in medical school. That's me in that very operating room. While there, I was struck by a passage that I read from Anesthesia, which stated, "Me struck me patient on the cranium with me mallet, rendering him hopefully unconscious and not dead." Indeed, it is amazing the advances we have made in the past 200 years. And of course, we have made amazing advances in electricity. Let us not forget my favorite of all time, Nikola Tesla, the genius of electricity that gave us alternating current, making it much safer and practical to deliver electricity throughout the world, ultimately winning over Thomas Edison's direct current. Here you see some of the very first uses of electricity in medicine. Indeed, electricity was used around the world by physicians and gaining much success in the treatment of various illnesses. However, around the time of the turn of the century, through the powerful influence of the new up-and-coming petroleum industry, pharmaceuticals were discovered. The pharmaceutical industry made it a point to vilify, through their powerful lobby, doctors utilizing electricity in medicine and made them out to look like quackery. And now there's a pill for every itis. Indeed, like the advances made in anesthesia from the use of a mallet to today's modern anesthesia, neuropathy treatments have advanced. And in keeping with our topic of electroceuticals, many advancements have been made in the past several decades. And what is unique about this is that it does not use pharmacology. The new and novel combining of local anesthetics with electronic cell signaling. The same treatment you are getting today shows efficacy in managing the difficult challenge of treating peripheral neuropathy. Renowned neurosurgeon Peter M. Carney, MD, states that if we understand that you can change how living cells function by changing their mechanics at the cellular level, you can heal them. And that is what combined electroanalgesic therapy does. By providing electronic signaling, delivering specific parameters of electroanalgesia, employing both varied amplitudes and frequencies of electronic signals. In other words, instead of giving you a prescription medicine, we're utilizing electricity, which provides these complex waveforms designed to reduce inflammation and increase blood flow, and this helps your neuropathy. I have been privileged to meet and know personally Dr. Robert Odell, MD, PhD, who has done the mainstay of research and testing and development of one of the latest machines that can deliver these sophisticated waveforms. It is called the synexus. Another friend of mine and fellow member of the Association of Extremity Nerve Surgeons, Dr. Cynthia Cernak, published the first paper of significance in the lower extremity with 116 patients, demonstrating an 87% success rate with this form of electroanalgesic therapy. I have also had the privilege of meeting Richard Sonyard, PhD, who, along with Dr. Odell, refined the synexus machine that you will be treated with here in our Neuropathy Care Center. As mentioned before, there are many forms of electrical stimulation. You've experienced some of these in physical therapy in the past, such as Russian stem, E-stem, galvanic currents, interferential currents, and even TENS units. But these are far different from the new neurostimulating machines such as the synexus, which has such advancements that as little as 2.5 years ago, some of the currents did not even exist. So in conclusion, in addition to pain relief, we have noted other improvements. These include increased active movements of the extremities, restoration of sensory function of the affected extremities, improved sleep, relief from muscle spasms, mental status, and quality of life. This is Dr. Robert Parker. I hope this has been helpful in educating you as to what these modalities are and how they fit into the treatment of neuropathy. Thank you.